with an open mind, ready to learn, and ask your questions. You can do so by putting your questions in the chat, and we will have someone who is more than willing to facilitate your questions being heard. We thank you for your presence here. As a ministry, we are destined to make sure that our members and our wider community are informed about those things that are affecting our health. This session for this afternoon is a follow-up to our session that was done in January on COVID-19. Our focus for this afternoon is looking at COVID-19 in relation to our children, and we have some great information ready for you. My ministry partner is Dr. Norma Smalls-Manty, and at the end of our opening prayer, Dr. Manty will introduce our host for this evening. So can we bow our heads for prayer? Father God, you in your awesome wisdom saw this time and place. And we just want to thank you, Father, that we're still here 2 years into a pandemic, and we're still here. And you've given us knowledge. We want to share that knowledge with those who are affected by this awful disease. So, Father, in everything that we say and do this afternoon, may your name be glorified. And we ask God that we will share the information so that lives can be saved and we can live healthier, happy lives. In Jesus' name I pray. Amen. Dr. Norma Smalls-Manty, over to you.
Good afternoon. I hope everybody today will enjoy and learn a lot from these two professionals who are here to help you to be guided through this difficult time in our country and indeed the world. I'm going to introduce my daughter, who's going to be the moderator of this session, Dr. Audra Smalls-Manty, MD, PhD. Audra Smalls-Manty conducted HIV vaccine research for a decade at several institutions, including the NIH. She completed her PhD in pathology at the University of Oxford in England through the NIH Oxford Cambridge Scholars Program. Audra later earned her medical degree from Columbia University and completed her psychiatry residency at the Mount Sinai Hospital in New York. She currently works at Columbia University Irving Medical Center and the Brooklyn Methodist Hospital, both in New York. She works as an emergency room psychiatrist at those two hospitals. Very importantly, Audra is a regular contributor to the TV ABC News medical unit. What is very pleasing to the family is that Audra has recently published a book. It's called Anjali the Brave, All About Vaccines. And it's the story of a young girl who's nervous about getting the COVID-19 vaccine, but gains confidence from her doctor after learning how vaccines work and about the amazing scientists that helped create the vaccines. The book is currently available for pre-order and will be released on Wednesday, February 23rd on Amazon, Barnes & Nobles, and other major retailers where books are sold. So without further ado, turn it over to
Hello, everyone. It's great to join you all here today for the program on COVID vaccines and COVID in general with our children and what parents need to know. And we are joined here by two very esteemed pediatricians that I would like to introduce. who will be talking with us first about COVID, and then we'll follow up with questions. So if you have any questions, please feel free to put them in the chat, and we'll get to them at the conclusion of their presentations. So first, I'd like to introduce Dr. Michelle Barnes-Marshall, who is a pediatrician with over 29 years of practice in child and adolescent medicine in Washington, D.C. She went to college at Northern Caribbean University and Andrews University. Dr. Barnes graduated with her medical degree from Meharry Medical College and completed her pediatric internship and residency at Georgetown University Hospital. She is married to Archie and has 2 adult children. When not working, she enjoys going for walks, baking, cake decorating, and getting a good night's sleep. Our second presenter is Dr. Ernestina Gambra, who's a first-year pediatric resident at Children's National in Washington, D.C. She was born and raised in Philadelphia, the youngest of 5 sisters. Her family is originally from Ghana, West Africa, like my own, and she obtained her MD and a master's degree in bioethics in May 2021 from Temple University in Philadelphia. And now, without further ado, we will begin our presentations, first with Dr. Marshall.
Hello, everyone. Okay, hope you see my slide. We're talking about coronavirus and our children. Hard to believe that we're 2 years into talking about this virus. But just a brief overview of coronavirus. The coronavirus is a large family of viruses that infect humans, cattle, camels, and bats. And there are even some that infect only dogs and cats. This virus has been around for many, many years. But now we're talking about the coronavirus, about the COVID vaccine, COVID-19. The name coronavirus was given by the World Health Organization and means, or the word coronavirus, COVID-19 was a name given by the World Health Organization and it means coronavirus disease 2019. It doesn't mean we have had 18 other coronavirus viruses before. It just means coronavirus 2019. The virus was later renamed SARS, S-A-R-S COVID-19 for severe acute respiratory distress syndrome. Several years ago, there was another SARS epidemic. It didn't go as severely across the world, but there was another SARS virus, and we know that this COVID vaccine affects primarily the lungs. So it was given the name severe acute respiratory syndrome, coronavirus 2. The COVID-19 starts with droplets from an infected person's cough, sneeze, or even your breath. And these droplets can be in the air or on surfaces that you touch, which you can then transfer when you touch your eyes, your nose, or your mouth. We know for sure that the virus has entered the nose, but people don't realize just by touching a surface, rubbing your eyes, you can get this virus. And the whole reason behind wearing a mask was that because this is the air where it's primarily spread, talking can spread the virus so much, and in particular singing. With the coronavirus, the symptoms may appear anywhere from 2 to 14 days after exposure. Tends to peak around day 6, but anywhere from 2 to 14 days before you can be infectious, before you have symptoms from this virus. And the symptoms we know primarily fever and congestion, cough. In my practice, quite a few of the children present without the fever, without the cough or the respiratory symptoms, and quite a few children present with belly pain. It was interesting earlier on how many kids are coming in for belly pain. We're looking back, how many children I saw who came in for vomiting and belly pain who may have had COVID in 2020 in the early part of the pandemic. Those who come in with a severe cough and the chest pain, you kind of say, yeah, probably most likely COVID. And a few will present with only the loss of taste or smell, and some with a rash, primarily on the feet and hands, a very kind of red-looking rash on the hands and feet, and a sore throat that some may mistake as another virus or strep throat and ends up being COVID. So these are the main symptoms you'll see, quite a few symptoms. Now, many viruses affect both the respiratory and the GI and the skin system at the same time. Up to 50% of children and adolescents might have COVID-19 without any symptoms. And so you can see this virus can spread quite a bit if 1 in 2 children may not have any symptoms and spread it to older relatives and friends. Children are less likely to become severely ill. Don't know the reason for this. I just kind of think children tend to be healthier. They're outdoor playing more. And especially with how the school lunches are made, they're probably getting healthier meals. I don't know the reason, but children seem not to get as sick as the adults with this virus. There are certain conditions that may cause more severe symptoms. Number one seems to be obesity. And we are aware that we're becoming more obese in this country, and we've seen sicker children with obesity. Diabetes, where your body doesn't handle sugar very well, so you don't fight off infections as well. Asthma, which is a chronic respiratory disease. Children born with heart disease, congenital heart disease, and some genetic conditions may also cause you to have more severe symptoms. And the part that is with our church, we see more cases of severe COVID in Hispanic and Black children. Again, not sure for the reasons for that. Could be disparities with our healthcare system or nutrition in general, but Hispanic and Black children seem to have worse symptoms. How does a coronavirus cause infection? Trying to change my screen here a bit. Now one sec. Give me a moment, and having the issue with my slide. Now, how does the coronavirus cause infection? The virus infects your body by entering healthy cells. The virus then makes copies of itself and multiplies throughout your body. The virus has spikes on it that attach to receptors in your lungs. I won't give the full name. They're called ACE receptors for short. And these are especially concentrated in the lungs. Once inside, the coronavirus hijacks the healthy cells and takes command. And eventually it kills some of the healthy cells. The virus moves down your respiratory tract into your mouth, your nose, your throat, and your lungs. Now, the lower airways have more of these ACE2 receptors. So this virus can go very deep, much deeper than other respiratory viruses, where it can multiply. And once in your lungs become inflamed, making it hard for you to breathe. And this can lead to pneumonia and infection of the tiny air sacs. And this pneumonia is viral, and viruses don't respond to antibiotics. That's why it's so hard to treat, it's impossible to treat. As fluid collects in your lungs, they carry less oxygen to your blood, and that means your vital organs get less oxygen, and this can cause your kidneys, your lungs, and your liver to shut down and stop working. And I'm going to go ahead and hand over now to Dr. Gambra to continue.
Okay, so I'm just going to share my screen. Right. So I'm going to talk a little bit about a few topics. First, I'm just going to discuss a little bit current isolation guidelines for both children and adults. And you'll have to excuse me, I'm in the hospital right now. But as far as those current isolation guidelines, as we all probably well know, regardless of vaccination status, the CDC now recommends that we all isolate at home for a minimum of 5 days. After 5 days have passed from symptom onset or a positive test, the individual who has tested positive may end their isolation if they're asymptomatic or if their symptoms are improving. Those who have had fevers need to remain in isolation until a minimum of 24 hours have passed since their last fever while they've been off fever-reducing medication, so like Tylenol, ibuprofen, things like that.
Okay, the next thing I'm just going to discuss are guidelines to return to play. And by return to play, I mean returning to physical education in school or even sports teams. I thought this was an important topic to discuss just because we all know that during the pandemic, our nation's obesity epidemic has increased. So notably, the prevalence of obesity in children has increased as well, most significantly for children 5 through 9. And specifically those whose families have lower income, and especially our Hispanic and non-Hispanic Black populations, which has widened the gap for disparities in these populations. And so as far as guidelines to return to sports, physical education in school, they differ a little bit between younger children and older children, just with a little bit more specificity for older children. So for younger children, the guidelines include that they've completed isolation, as we discussed on the previous slide, that they can go back to all their normal activities of daily life. So they're able to dress themselves if they were able to do that before, feed themselves, go up and down stairs as they previously were able to do. Making sure they have no concerning signs or symptoms. And for children who were moderately or severely sick, we do recommend that they see their pediatrician and obtain clearance from them. For older children, adolescents, and teens, for those who were asymptomatic or had milder disease, the CDC, the AAP actually recommends that these children be symptom-free for at least 1 day and then spend 2 days kind of gradually increasing their physical activity back to prior. So the recommendation is that they don't participate in kind of rigorous games or physical activity until about day 3. For children, older children who have had a moderate case of COVID, we want them to be symptom-free again for at least 1 day and then spend about 4 days gradually increasing their physical activity back to their prior max. And then we recommend that they don't participate in any strenuous physical activity or games before day 5. Now for both groups, for younger children and older children, they should continue to mask up for all physical activity until 10 days after their initial positive tests or their initial symptom onset. So the next topic I'm going to talk about is something you may or may not have heard of called long COVID. And so long COVID, scientists are finding kind of occurs after someone has recovered from an acute COVID illness and they may still have some lingering symptoms at least 30 days or more from that initial illness. So we've seen long COVID in adults and children, but specifically in children, studies have shown that between 13 to 35% of children who are diagnosed with COVID experience some post-COVID symptoms. Most commonly in children, we see fatigue, persistent headaches, some abdominal pain or belly pain, and then depression and anxiety. This is a little different from what we see in adults. In adults, studies have shown that we see more respiratory symptoms. But in both groups, these problems can be disruptive and interfere with normal activity in school, work, exercise, sports, other hobbies. Scientists are still kind of studying and learning more about long COVID and how long it persists, but there are several hospitals around the country, including Children's National, who have started long COVID clinics. And I'm gonna try to put this link, I'm gonna try to put this link in the chat at some point. It's just a link to Children's National's post-COVID or long COVID program for any parents or anyone who knows any children who seem to still be experiencing some symptoms kind of long after their initial acute COVID illness. So next, I'm just going to talk a little bit about vaccination in children. And so we may have heard have already learned a lot about how the vaccine works, but just for a short review. So looking at this slide first. So this is a typical cell in our body. In the cells in our body, we have a nucleus where the DNA is located, and then we have the cytoplasm where molecules called mRNA, which are other genetic material, and also proteins are also located. And so again, mentioning the DNA that's found in the nucleus, this DNA is kind of the code for our entire genetic material. So what makes up you and what makes up me. But DNA kind of in and of itself in this form, while it's in the nucleus, it does nothing to kind of keep the cells powered or anything really around our bodies. And so what the cell does is that it creates a copy of itself, which is one-stranded, called messenger RNA. And the messenger RNA acts kind of like an instruction manual that tells the cell kind of what proteins to make and what actions to do within the cell. And so this messenger RNA is what actually leaves the nucleus and enters the cytoplasm of the cells. All right, so going back to how the COVID-19 vaccines work, specifically the Pfizer vaccine that's authorized in children, the mRNA that is the active ingredient in the COVID-19 vaccine codes for a spike protein on the outside of the coronavirus. And so this mRNA is again surrounded by fat bubbles, which the outside membrane of the cells are also, they also have fat around them. And so this allows the mRNA in the vaccine to enter into the cells in the cytoplasm. Then once the COVID mRNA is in your cytoplasm, it's translated into making the spike protein that is on the coronavirus. And so your body recognizes the spike protein, and then it forms antibodies to that spike protein. And so that's a basic rundown of how the vaccine works. So it doesn't change your own DNA, it doesn't change your own mRNA, it doesn't insert itself really into the DNA of your own cells. So it doesn't change your cells in any way, but it allows your body to create antibodies to the spike protein. So now I'm just gonna talk a little bit about some questions that have come up for me in clinic and some things parents might wanna know. And so one question that I've heard is the COVID-19 vaccine that children get the same as the vaccines that are given to adults and teens? And this would be children over 5, for which the COVID-19 vaccine is currently authorized for. And the answer is yes and no. So yes, in the sense that the active ingredient in the COVID-19 vaccines created by Pfizer for children, teens, and adults all contain the same active ingredient, which is what we discussed before, the mRNA encoding the viral spike protein on the COVID-19 virus. However, one important difference is that the dose is different for children between 5 and 11 versus people 12 years and older. And so the way we're kind of able to distinguish is just that the COVID-19 vaccine for children 5 to 11 just comes in a different vial with a different color cap, which just makes it distinguishable and allows our medical professionals to administer the correct vaccine to children of the correct age. So some side effects that a child might experience after getting this vaccine, most of these side effects are similar to those side effects that come with routine childhood vaccination. And so anytime someone gets an injection, they might have some soreness at that injection site. They might experience some headaches, muscle aches, low-grade fevers. And if you all have children, you've kind of probably already experienced this when your kids get their routine vaccinations, if they do get those. And so if your child does feel any pain or discomfort, you can always soothe that area with a washcloth or give them some pain or fever reducing medications after vaccination. But we don't recommend any Tylenol, ibuprofen, or any of those measures prior to vaccination. Some kind of danger signs that I would contact your child's pediatrician or healthcare provider would be if the redness or pain at the injection site persists or gets worse after 24 hours, or if any of these side effects listed continue or become worrisome to caregivers. Another question that I get, I've heard frequently in clinic is it safe to get the COVID-19 vaccine for kids on the same day as getting their other routine childhood shots? And the answer currently from the AAP is just reiterating, kind of the importance of routine childhood vaccination. We don't want any children to kind of fall behind in their vaccinations. And so currently the AAP does support co-administration of routine childhood and adolescent immunizations with the COVID-19 vaccines. Or if you feel uncomfortable, if your family feels uncomfortable, there's always the option to kind of get that vaccination in the days before or after your routine childhood shots. If during the visit, multiple vaccines are being given, each injection is supposed to be given kind of at a different injection site based on the recommendations for those vaccines that they are getting that day. And then the last thing I kind of have is just some most recent news. We know currently that the COVID-19 vaccine is authorized for children between ages 5 and 11 and also people 12 years and older. And there had been discussions about the FDA meeting to discuss, FDA with Pfizer meeting to kind of discuss the utilization and beginning the 2 series vaccination in children below 5. But just yesterday, the decision was kind of made to put a pause on this and collect further data. From my reading, it seems like the FDA and Pfizer expect to have more data kind of on the vaccination for COVID-19 in children under 11 more towards April. So that's the end of my presentation. I'm going to turn it back over to Dr. Barnes-Marshall to continue.
Okay, are we ready for the questions? Adjua?
Yes.
Okay.
So thank you all very much for your wonderful presentations and helping us understand the disease progression, how we get infected, and how we can protect ourselves with vaccines and how they work. And so I do want to encourage anyone that has any questions related to what was discussed to please put them in the chat or even raise your hand. We do have a question here that both of you can answer, and that is, what happens if a child receives the adult dose mistakenly?
If the dose is given, we really don't do anything, nothing different. Just observe. The doses are made, when the vaccine doses are made, they're trying to look at the best response, how many persons respond to a certain dosage. So they kind of move around with the dosage and they realize that for adults, 0.3 of the solution worked for adults to give a good immune response, and 0.2 worked for the 5 through 11 year age group. And the reason for the delay in the younger ones, they're trying to figure out what dosage will give you the best response in the 6 months to 6 months to 4 year age group, and whether they'll need 2 doses or 3 doses to get that immune response. So if a child gets the adult dosage, you're going to get your immune response. You just may have more of the symptoms of the fever and the body aches and the general malaise feeling, but it will still work.
And one question that I had was, right now, only about maybe 50% of the children that are eligible to get the vaccine, age 5 through 17, have received it. So from parents that you see, or even from children, what are some of the things that they're saying or that you're observing that might be preventing them from getting this COVID vaccine? And what are your ideas of maybe how to address that?
So for me, for parents that I've seen in the office who are kind of hesitant against getting their kids vaccinated against COVID, a couple of things come up. So for one thing, I think the same kind of concern with the adult vaccine, they feel like it was developed quickly. They're concerned about the emergency use authorization portion. And then also just not completely understanding how the vaccine works. I still sometimes hear parents concerned that the COVID-19 vaccine might change their child's DNA or things like that. And I think my approach is to kind of, we have a lot of information sheets in our office, and I kind of just try to talk parents through how it works briefly. And then also explain that the technology that this vaccine, the technology that's being utilized has been kind of being developed over decades. It's not particularly new. And so I kind of just try to assuage their concerns by giving more information.
There is always a general fear of the unknown. And we as humans like to be in control. And when we can't control a situation, we get fearful, and we should with fear. The vaccine, the COVID vaccine is a new vaccine because we never had to deal with COVID-19 before. But the technology has actually been around for over close to 30 years. The World Health Organization, linking from the different countries, because we had to get something out quickly for a pandemic, different countries did unite with the information they had using this technology that was around for almost 30 years to make the vaccine. In the African American population, I still hear the fears based on the Tuskegee experiment, not the Tuskegee, blanking on the name, I think of the Alabama experiment many years ago when they tested syphilis on the African American population. So there's still a lot of fear that they're experimenting on us. But no, this vaccine was made to save lives.
Okay. And I'm just curious also, when you do explain a little bit more about the vaccine, how it works, especially as you explained, Dr. Gambra, do you feel that parents, or do you see parents say, okay, maybe I will now give this vaccine to my children, or do they still hold out for a little bit longer?
I think I see both, to be honest. Sometimes I try to, talk about how I've gotten the vaccine or how I don't have any children, but my niece has gotten the vaccine. But I would say it's a mix of both. I think it depends on the parent and kind of what their experiences and what their background sometimes is as well.
Okay. Another question that we have is, one of my classmates has COVID, and my question is, how long should they quarantine?
It varies also whether that classmate had the vaccine, yes or no. The current guidelines have kind of changed that if you have had the vaccine, it's more, if you have had the vaccine 5 days, and if you don't have symptoms, you can go back to class. They do recommend that you do wear a mask in class to complete the other 5 days for the 10 days. And the slide that Dr. Gambra showed also showed the activity levels of those who need to go back.
Okay.
And you should be without symptoms, fever-free for over 24 hours, and without any symptoms, not just a fever, all symptoms before you return to class.
Okay. Another question is, are the number of children being hospitalized for COVID-19 increasing now that the Omicron variant is what we see the most, because the Omicron variant is more easy to spread?
So I don't have specific kind of numbers to support this. I think hospitalizations in the past couple of days over the country, just in general, have kind of been decreasing after the initial peak. After Omicron, I will say that kind of when the initial surge of Omicron, hospitalizations among children did increase, even at children's. We were kind of at capacity for a couple of days, and it wasn't even just children being hospitalized due to their COVID symptoms. I think a lot of what we were seeing was children being hospitalized with chronic conditions that were exacerbated because they had contracted COVID, in addition to like being hospitalized due to COVID-19 infection. And so I would see kids who had like type 1 diabetes and were coming in with DKA, and we would like incidentally, you know, find that they had COVID, or like children with irritable bowel disease who would come in like a flare, and we like recognized that they had also had COVID. So I think initially it did surge with the surge of Omicron.
Okay. And Ms. Reed also has a question about what are some of the most noticed side effects from the vaccine?
Sore arms. Sore arms, number one, followed by probably fever and a feeling of just general, I don't feel well, I feel tired and achy. I know I had that after my vaccine. But I also knew the vaccine was working. That's why I had those symptoms. So I welcomed those side effects for a while, knowing it was building up immunity.
That is true. It is your body practicing fighting an infection. Another question we have is, early in the pandemic, we thought COVID was mostly an older person's disease, but now we have to be more careful with children catching COVID because of the Omicron variant being 17 times more easy to spread. I think we're trying to ask, is this still are children at a lot more risk now from COVID than they were before?
I don't know if they're more at risk. Just in general, children, as I was mentioned on an earlier slide, 50% of children and teens may not have symptoms. And just in general, either they get the Omicron variant, they seem not to be as sick as the adults. And we're not sure why, but children just do better with COVID in general than the adults.
And I'll also add, I know when, as they're doing more research into the Omicron variant, one reason why they thought children were getting more susceptible, a lot of the ones under 5 weren't vaccinated. And I would say most people that I know that caught COVID during the winter time caught it from children under 5, but also with the mutations on the Omicron variant, they're finding that it attaches more to your upper respiratory, where children have smaller upper respiratory passages. And so they're more likely to get clogged with mucus and things like that. So that could be one reason why they seem to be showing more symptoms now of infection with the Omicron variant than they were before, with other variants of the COVID virus, but also, again, it spreads so much more easily. I just want to make sure I'm not missing any raised hands, but if there are any other questions that people had related to COVID vaccines in general. And also, if the pediatricians also had any other thoughts. I do see a question from Dr. Smalls, and there is another question as well. Dr. Smalls?
Hi. So what I understand from your presentation is that earlier during the COVID pandemic, we were more worried about the elderly, those with diabetes, heart disease, lung disease. But that was with one type of COVID variant. Now we are with the Omicron variant, 17 times easier to catch and spread. You're about at least 10 times more apt to be hospitalized. More people are being hospitalized now because more people are catching it. And as it's so much more easy to spread, we should still be very careful with our children. We should not say, oh, children are healthy and they can weather the storm. We all know that. But what I understand you as saying is that you still have to be careful with your children. You still have to know that we're in a different ball game with the Omicron variant because it spreads very quickly and you can become very ill from it. So that we should take this very seriously, the difference in the type of virus that is that we're meeting, survival of the fittest. The virus says, I want to stay here on Earth and continue to cause havoc. So I'm going to keep changing so I can keep making people ill. Is that what I understand? There's one other statement. Can I make another?
Yes. The next question is, should we get both the COVID vaccine and the flu vaccine at the same time? And why does it also seem like there's been a reduction in the flu cases that we've seen this year?
Yes, I do recommend getting them both. I think an added benefit of wearing masks is that we have less flu in general.
Yeah.
The flu is a larger particle than the coronavirus. So the masks are filtering it out. And so a benefit of wearing a mask is to prevent flu. I do recommend that you can also get your childhood immunizations along with the COVID vaccine. They can all be given at the same time.
And I see that Ms. Smith has her hand raised, so I'll ask you to ask your question.
Okay, thanks for the information that your ladies or doctors are giving. I just have a question. If a child get COVID twice, does it how much effect does it really have on the body? Do you know, has there been any kind of research if does their body break down? Does does any system really does it affect their systems, bodily systems? Say they have no pre-existing condition. I'm just wondering how much it does affect their immune system.
Are you talking in terms of like the long COVID syndrome, or are you talking in terms of like the different physical parts of the body?
The symptoms, if they've had it twice. Say they had COVID 6 months ago, then here 6 months later they're testing positive for COVID again. They now have a second bout of COVID. I'm just wondering the long term, if do we know what kind of long-term effect it might have on their bodies?
You can get COVID. The COVID virus likes to have plastic surgery and keeps on changing its features. With the same basic virus with different features, keeps on changing. And most persons who get the COVID vaccine, will just have another bout of being sick. In terms of long-term problems, it would most likely be to the long COVID syndrome, where you have the chronic fatigue or the headaches, and the anxiety or depression is a big part of having COVID twice. It plays a part on your mind, and maybe the heart, but of course you would get, even doctor would be able to check that and see, but not to other parts of the body I can think of. And I guess it's a good time to just, since you asked a question, there is a condition called MISC for short, which I can type in the chat, where some persons after having COVID, children after COVID, can develop an inflammatory response to it with high fevers, a skin rash, vomiting, and gastrointestinal symptoms. And if that happens, that's an emergency. You do need to be admitted to the hospital for. So that is possible complication, but you'd have symptoms of that. Your child would be very sick.
Okay. The next question is there a specific recommendation for long hauler syndrome in children?
So by long hauler syndrome, I think you're referring to the post-COVID syndrome or long COVID. And so, as we talked about before, this link that I just posted is kind of the link to the long COVID clinic at Children's National, which if your child has had COVID and it's 30 days or longer after their initial infection, and they're still kind of showing symptoms, or the ones we discussed are other symptoms, on that website, you can see kind of some inclusion criteria, and you can even email the program to set up an appointment to speak with someone as well. But from my reading, we've seen kind of these symptoms in long COVID syndrome go away after 3 months, and some children after 8 months, and others, and it really just depends. I think we're still learning a lot about it.
Okay. There's a question about why don't they advertise shellfish in the vaccine, since I didn't think there was any in the vaccine. And I will almost answer that myself. Like, in terms of the ingredient list, there's no shellfish listed. So although if any of the speakers want to say something about it, but it includes sugars, salt compounds, polyethylene glycol, which is what they thought might have been giving the initial allergic reactions, but no shellfish from the ingredients that I've read.
And I'll add to that, there's no shellfish, there's no peanuts, and there are no eggs.
And no latex.
And latex, yes.
And I see Ms. Jones has her hand raised. Would you like to ask a question?
Yes, can you hear me?
Yes.
Okay, I just wanted to mention, because when I got the vaccine, the first vaccine for my daughter, of course, you're always told, are they allergic to something? But the second time, when I got the booster shot, I was asked more specifically whether, what she was allergic to. And they did tell me it was traces of shellfish in the vaccine. So instead of her waiting the normal 15 minutes, I had to have her wait 30 minutes in case she had a reaction from her being allergic to shellfish. So there are traces of shellfish in the vaccine.
Okay, well, I'm not sure where the previous, the people that were giving her the vaccine from. I've read the ingredient list several times and not seen any shellfish, and that is completely different to the information that I have received. So I would venture to say that they were also being extra cautious, because they always ask you about allergies when you get a vaccine or any type of medications before they give you anything at a hospital. That's the one thing they ask you: what medications are you on and what are your allergies? and maybe just because they know she already has a hypersensitivity to something, they just want to make sure they watch her for longer. That's what I'm venturing to think is more so of what they were trying to convey.
And just to add to that, I do know for the first dose, they recommend observation for 15 minutes, the second dose, 10 minutes. However, if you have a history of any kind of food allergy, they recommend staying a longer period, not because a vaccine has shellfish in there or eggs, it's just as a cautionary measure.
There was also another question about what were your thoughts about children that might get COVID at home, at school, and then come home and pass it to parents and grandparents. Do you have any advice for mitigation measures, especially now that a lot of schools seem to be reducing, seem to be getting rid of mask mandates? Any advice to parents now that have to juggle this potentially when it happens in Maryland, likely soon? How to prevent kids, especially the younger ones that are not vaccinated, from getting it and passing it on to their more susceptible family members?
I think that this kind of begs the case again why everyone who's eligible for a vaccine should be getting a vaccine, especially those of us who are adults and may be immunocompromised or have chronic conditions at home. I think also another point being said is that, even if mask mandates kind of disappear from schools, it doesn't mean that your child can't wear a mask at school. So I think two things: we should all get vaccinated when we can, and then continue wearing masks at our discretion.
I think that's great advice. Definitely, like I said, I will probably be wearing masks for a long time in the hospital setting, just because you don't know who might have COVID. You don't want to catch COVID, potentially spread it to other patients or other people at home. So it might become very much a standard piece of the medical equipment that we're wearing a lot of times, just like doctors carry their stethoscope all the time or other things. So definitely, if you are at risk or feel like you're in a risky situation, like Dr. Gambra said, you can still wear your mask even if it's not mandated. And just before we wrap up soon, I just want to make sure that there are no other questions that I'm missing, whether people want to throw anything else in the chat or have any other questions by raising their hand. And with that, I'll give Dr. Gambra and Dr. Marshall just, do you have any last thoughts that you would like to share with us?
Let me just share my slide real quickly. Give me one moment. Okay. Let's see. Give me a moment. Just in summary, for the pandemic, is my screen showing okay?
Not yet.
I'm not sure what I'm doing wrong, but I'm not getting it to work. How is that? Is that better?
We don't quite see it yet.
Okay, I'll just end it. I'm not getting it to go. But in summary, during the pandemic, we've all received a recipe from someone with a magic soup or tea to make us all better from COVID. There's no doubt that good health, you have a better chance of fighting this. So I do, since I can't get my screen up, sorry about that. The New Start program, which talks about just basic good health, nutrition, exercise, rest, water. I do recommend that. And I do also recommend that we all get vitamin D into our bodies somehow. If you can't get it through natural sunlight, take vitamin D just to help you to build up your immune system. Not sure how it works, but vitamin D works with inflammation and zinc to help us to be better in fighting off this virus.
Thank
Get
you.
your vaccine.
Thank you so much. And Dr. Gambra, do you have any other statements?
All I would say is that, COVID-19 is still out there. We should just continue being vigilant, continue protecting ourselves and our children, and everyone should get vaccinated when they're able to and get their booster shots as well.
Okay, well, thank you very, very much.
Ladies, thank you so very much. Wanna thank you again for taking the time to share your expertise with our church family and the wider community. This presentation will be available in its recorded form and be on the church's website. So please continue to share, like. We are also here to serve as your health ministries team. So if there's something that is of interest to you that you want more information on, please don't forget to share it or send us your questions. Our email address is healthministries@sda.org. You can always send us your questions. We'd be more than happy to look into it for future presentations. I want to say thank you again to all those of you who participated this afternoon. And in closing, wanting to make sure that you don't forget that our host, Dr. Adjoa Smalls-Manti, is a proud author of a book entitled Angeli the Brave, something that we should make sure that every child gets its hands on. The release date is February 23rd, Dr. Ajwa, I think, yes.
Yes.
And it will be available on Amazon and Barnes and Nobles. Please support one of our own. Share it to your schools, your neighbors, your friends. Let's get the word out so that our community can be healthier. Again, thank you all so very much. I want to say a special thanks to our communications department, Sister Natasha and company, for their support of this program. Please continue to wear your mask, wash your hands, socially distance as needed. Look out for the guidance given to us by our health organization. We recognize this is constantly changing, and we want to make sure an informed population is a healthier population. Until next time, may God continue to bless. Thank you so very much. Have a pleasant afternoon.